Moving on then to the first of our entrepreneurial discussions. And we said at the outset that we'd look at some early stage, mid stage, and then the later stage. And starting at the beginning, I'm delighted that we're joined this morning by Dr. Kellie Adamson of Septec. Changing the rules of sepsis diagnosis, which I think is a fantastic line and will set it up nicely. And Kellie has a particular angle that I think Heidi's going to explore with her, which is around this European funding and accessing European funding as part of a consortium that Kellie has taken part in. So in conversation with our own Heidi Corr of Dublin BIC, I'll ask you to introduce or say a big hello to Kellie Adamson, Dr. Kellie Adamson of Septec.
Hi, good morning. Thank you, Connor and Michael, for that great introduction. Thank you. I'm Heidi Corr, investment consultant with Dublin BIC, and I'm absolutely very privileged to be in conversation with Dr. Kellie Adamson, CSO, co-founder with Dr. Elaine Spain of Septec. As Connor mentioned there, Septec's core technology detects sepsis in minutes, not hours. Sepsis is a life-threatening illness with annually 49 million people diagnosed and 11 million of those dying. Up to 80% of those could be avoided with early diagnosis. Kellie, that is some weight on your shoulders to have with your technology. Can you please take us back to the beginning of your journey, which led ultimately to the amazing 2.4 million award by the EIC and the European Innovation Council funding that Michael mentioned earlier? Over to you.
Yeah, so this actually started way back with myself and Elaine's PhDs. So Elaine was in Dublin City University and I was through the Royal College of Surgeons in Ireland, but I was based mostly in DCU. It was a collaborative PhD. And a lot of my background was through biomaterial science, and Elaine was ultrasensitive electrochemical detection. And basically by the end of kind of both of our PhDs and Elaine's postdoc, we realized that we combined both of our technologies together, we could basically really enhance the capture of low numbers of cells in a very, very quick time frame. So this was basically where we decided to go to the next step, and we applied for an Enterprise Ireland feasibility fund to see where the market need was for this technology. So we knew we could do early stage detection, low numbers of cells within a very quick time frame. And what actually came back then was sepsis. And at that time, that was 2013, there wasn't a lot of sepsis awareness at that time. So we were like, that's brilliant. So that's when we started, and we applied for the Enterprise Ireland Commercialisation Fund, which we were successful in. That was in 2014. We spent 2 years developing the cartridge test. And by that point, we had just got it to work, and the commercialisation fund was actually running out. So we applied for a second commercialisation fund, which we were successful in, which started in 2016. And then over those 2 years, we actually realized that, now we have the cartridge test, but how are we going to get it outside of the lab? And that's where it came in, where we actually developed an analyzer instrument to go with that cartridge test. So over those 2 years, then we'd come to the point where we had a function prototype and a function prototype analyzer. Following on from that, then we applied for the SFI Future Innovator Prize. So this was a really interesting new prize. It was the first time it had been run. And this was all based around how can you quantify your solution, and is your solution what your end users really need? So we were successful in reaching the second phase of that, which was €200,000. And that whole 9 months was basically getting out there, talking to clinicians, nurses, doing focus groups, interviewing over 80 clinicians across the world to figure out, is what we're doing what they need? And thankfully, the answer is yes, they really need it, they really want it, and they want it at the bedside. So then it was coming to the end of the SFI Future Innovator Prize, and we actually applied for a third Enterprise Ireland Commercialisation Fund. Enterprise Ireland have been absolutely amazing in terms of the support they've given us. They see the future in Septec, and they've put a lot of money into backing the development of the project. And we were successful then with the third fund, and that's actually just finished this month. So we really leveraged public funding as much as we can. And the next stage was to spin out of Dublin City University, raise the investment to really drive it forward in terms of the commercial developments that we need to do. But as Michael said, we're in an awkward position because we are high risk. So we require a lot of manufacturing. We're capital intensive. And because we are a Class C device, if we give the wrong result, that's detrimental to the patient. Regulatory requirements are really stringent. So it is a long enough development pathway to get it onto the market. So that's where kind of the EIC fund came in. So we decided, it was basically January of last year that we tried to get into the first application for the EIC fund. And we're so used to writing grants, we usually do 3-4 weeks and it's pumped out. The EIC is a whole other ballgame. It's a new world. 3 weeks is not enough for the EIC, so that would be my first tip. So we just missed the deadline for that. And then we got in contact with Lyra Consulting. So we actually we consulted with Lyra for the first application that we actually made for, and we were just under the threshold for being moving forward with the interview. So that's when we decided to then really push the efforts in to get to the second application, which was October of this year. And
Kellie,
we were absolutely delighted.
Can I just come in with a question there? Because I know when we were chatting earlier, you were mentioning there was obviously a lot to learn, not only from the 3 different commercialisation funds that you went for, but also when you first went in March 2020 for the EIC funding, there was a 1% success rate. And obviously on that occasion, you didn't sort of make that particular call. But what were the key learnings that you got, and what was the feedback that you got?
So the feedback is actually not very detailed when you do get the results from the EIC fund. So it is very hard to gauge you basically it's a scoring system. So you kind of know the certain sections that you've kind of scored lower on. But there are no actually detailed feedback. So you kind of just work off going, right, it's these sections where they're not really happy. So you need to try gauge, right, what are we missing? But that's where Lyra Consulting kind of came in. They've been through this process so many times that they kind of become part of your team and they help guide the process. So even with the lack of feedback that we got, they kind of knew where to go from that in that sense. Whereas if you were doing it on your own, it will be very hard to try to figure out what they're actually looking for.
The work that you did with the Science Foundation when you had the 200k grant and when you just missed out on the $1 million funding, the work that you actually carried out with that funding held you in super position in preparation for the EIC funding. Can you just expand on that? Because it links very much to one of the categories of why then you were awarded the EIC funding.
Yeah, so one of the things with the SFI Future Innovator Prize is how are you impactful? It's all about impact, it's specifically, especially from a societal point of view, and how do you quantify that impact? Whereas to that point, we hadn't really delved a lot into that. It was all about the development of the actual product itself. So over those 9 months, we actually carried out focus groups with hospitals. We carried out questionnaires. We interviewed over 80 clinicians across 50 countries. And we carried out a health economics study with a health economist to basically see if Septec was implemented in the clinical workflow, what impact did that have? And that really gave us a good justification for how Septec could really change clinical practice and what impact it could have on both the hospital and the patients. So without that work, it was really, we were purely relying on the technology and the validation in that sense. So combining both that and the societal impact and how realistically the effects that we could have on the healthcare system if we were implemented really gave us a shining light in terms of what the future of Septec would be. And I really feel like that if anyone is in that same situation, same sector as us, it's really important to get out there and do those interviews with key opinion leaders, try get a few focus groups. And if you do have the budget to do a health economic study, definitely.
Okay, so if because you mentioned the commercialisation funding ran out there, so if I can just take you back to where the business was, because you obviously started the business in 2014. So Michael mentioned earlier resilience. This this in December 2020 is now a 6-year resilience journey. Where were you guys at? Where were you, Elaine? How were you feeling at that time?
Yeah, so as Michael said, there's a lot of highs and lows, and it really is those few highs. There is a lot more lows than the highs, but when you get those highs, it really pushes you forward. So, and as well, myself and Elaine, having that other person there really does help push you forward. When one is starting to give up, the other one is like, no, and drags you along. So we've always kind of jumped in. We also pull each other up as we go along. But the way our product is, it is a long road. So we did know from the get-go that this could be a 10-year timeline for us before we get this onto the market. We're now 6 years in, so we're starting to see the light at the end of the tunnel, but it is the wins. So the fact it took 2 years to get the cartridge to work in the first place, once we got that working, that was, oh my God, absolutely brilliant. Now we got to the analyzer. It's in 2 year increments. It is a long process. But it's the fact that we're working on something that could just have such a huge impact, not just in Ireland, but across the globe. And to know that we could make that change, that is really something that just drives us forward. As a scientist, being able to do science that actually makes a difference to the world it's a driver alone in itself.
And how did you both feel then come January when you, out of 4,000 applications, you were the only Irish company that were awarded the 2.4 million? What were your thoughts? How did you feel?
It was literally like winning the lotto, if that's how I can actually say it. Because as you said, you need resilience. Like we were coming to, it was our last month's wage. This was a make or break for us. We gotten to a point where if this actually didn't come in, we were probably gone. So the fact that we got that email to say that we had gotten it, the fact that we got to the interview process, that alone for us was an absolute win. We never really thought that we would have the chance with such a low success rate. 1% is a needle in a haystack. So when we did get it, I don't think it's sunk in yet, to be honest. Yeah.
So it's a little bit like anyone that's had a baby, and I know, congratulations, both you and Elaine actually had a little boy and a little girl, so congratulations on that. I always compare it to, it's like everything leads up to this big event. So you got awarded the 2.4 million. Suddenly that's here. Where do you go from there? What's the plan?
Yeah, so we are looking to raise investment. It is capital intensive. So this has given us a really great runway to give us the time to be able to secure that round. So we had investors and soft commitments, but obviously now the EIC fund really validates the technology and validates where we are, and it de-risks it for these investors. So the whole plan now is to really just hit the ground running, to get those developments done, get the investment in, and basically bring the product to a point where it's ready for clinical trials by 2023. So the next 2 years are going to be extremely busy in terms of getting the system to a point where we're ready to do those clinical trials. But now it's really given us a good backing to be able to raise the investment that we need to really bring it to that point. So yeah, it's going to be a busy 2 years.
Okay. And just one final question. What is the end goal?
The end goal is to be able to see this through and see this on every shelf across every hospital across the globe. It is a very busy space. There are a lot of large players in this space. So the way to do this realistically is either going to be a partnership or acquisition at a certain time point. So we will be gauging our developments to really increase the value to get it to a point where it's ready to be partnered up with the multinational companies.
So hopefully we'll be looking for an acquisition of about 150 to 400 million, Kellie.
Here's hoping, yep.
Wishing you the very best on that. If anyone
Mel.
can, Elaine can. Thank you
Yeah.
so much for sharing that journey with us. Thank you. Resilience, I think, is going to be the key word for the day. Thank you.
Definitely, yeah.
And thank you so much, Kellie. I love that story, and I love the notion of the email landing. Like Willy Wonka's ticket had finally come through. Well done to you. Brilliant, brilliant story, and thanks for sharing. Before I let you go, can I ask you one question that came in? And it was around how difficult was that application process as you went through? And maybe just describe that for me if you would.
Yeah, it's a totally different ball game to any other grant application. One of the things that we found was you really need to put the time in. It's not a month's job. It's not a 2-month job. It's minimum 3 months. For us, it was realistically 6 months. And I think that's what really allowed us to have that winning application. There's a lot of detail required. You can't just say you're going to get out onto the market and you're going to get distributions involved. It needs to be country specific. You need to have names of distributors. You have to have letters of potential engagement if you can. It's really trying to justify and have that in-depth plan for when you get on the market, what happens next. It's not even just getting onto the market. So it's a really long process. So I would really need to take the time to be able to dig deep into those details. And one of the biggest things as well is letters of support. So everything you can do, back it up with a letter of support. So trying to get those again takes time. So it's a good 6-month process.
Superb. Kellie, thank you so much for sharing your story with us this morning. I really appreciate it, and continued success. And Heidi, thanks so much for sharing that particular discussion and some great insights that you took out. So thank you very much. And Michael, if I could just come back to you on just one question there, and it's around kind of accessing support and finance in a more general context. So Kellie was talking to us there about European funding, but our audience would love to know about, what do I do? How do I access funding in general, private funding particularly? And maybe you could just give me your piece on that before I let you go.
Absolutely. Respect to Kellie and Elaine on that enormous resilience. Serious respect. We touched on it very briefly a little bit earlier. My main thing is, like, fundraising is like anything else. It's like business development. You need to put the work into it. And you can't, in general, just rock up, pitch to somebody and expect to get funding. So you need to build a relationship with the people if you're looking to raise funding. So engage early with them. Tell them what you're going to do. Don't overpromise, underpromise, overdeliver. Make the connection. Maybe I'm not looking for funding now, but I will be looking for funding. Here's what we're doing, etc. I'll be back to you a little bit later. People like to hear, build that relationship, and that goes for VCs. In certain verticals, if you have something that's very, very strong, for example, there are specialist international VCs in the early stage area, and that might be, you could reach out to these guys, get involved, build a relationship. And with private people here, the same thing. Build the relationship with them from early. People are interested, respect their time, be well prepared, and you'll find that people will engage.
And it's almost like a sales pipeline that you're building. You're kind of working it, you're keeping in contact, and people will take that call, they'll take the virtual coffee, they will engage at the early stage.
People are, people are curious.
Yes.
And they're interested, a subset of them, in this risky area, and they know it's risky, so they will. Another quick little comment, maybe it's just slightly off, but just before we finish, is in terms of the areas of focus nowadays. I guess the next 7-year European Green Deal cuts across from climate and digitization, and that spills down then into national governments and the policy, etc. So those are the areas, but do bear in mind they're pretty broad churches. So, but those are probably the areas of focus for the coming period as well.
Thanks so much. Michael, thanks for sharing your insights with us this morning.
Thanks, Conor.
And you'll stay around. We might have some more later on. We'll see.